and both of our guest speakers for this session, which is under the CDSS series that is brought to you by Voice of Healthcare in association with Wolters Kluwer. So this is the 6th episode of the series with the title Role of Clinical Decision Support System in Neonatal Care. And to speak about it, I have with me Professor Dr. R. Kishore Kumar. Sir is the founder and chairman, Cloudnine Group of Hospitals, India. Senior consultant, neonatologist at Cloudnine Hospital, Jayanagar, Bengaluru, India. Also leading this conversation would be Dr. Rohit Arora. He's a consultant pediatrics and neonatology at Apollo Cradle Hospital, Gurgaon. So without further ado, I'll just hand it over to Dr. Rohit to take up this conversation further. Thank you.
Okay, thank you, Khushbu. Thanks for the introduction. And thanks for arranging this seminar. The Voice of Healthcare do come up with interesting seminars every now and then, and CDSS is no different. So, so technology has really taken us, in a different league altogether in our lives. It really made big inroads in our lives, and healthcare sector has also been affected a lot, I would say, through the technology. Few of the diseases which were totally considered uncurable, thanks to technology, they are being cured and taken care of. Similarly, artificial intelligence is also coming up with a lot of ado in our lives. And again, healthcare is no different. It is making inroads in the healthcare as well. So CDSS, Clinical Decision Support System, is on similar lines. It helps integrate patient data with the current available knowledge and helps us guide us in decision. So to talk about it further, we have Dr. K. Kishore Kumar, who's a dear friend. We know each other for last more than 6-7 years now through our common interest in simulation. As Khushbu has already introduced, Dr. Kishore Kumar is the founder, chairman of Cloudnine Group of Hospitals, the single specialty mother and child hospitals all across the country. And he's also an eminent neonatologist and pediatrician in Bangalore and actually all across India. He's an adjunct professor at Notre Dame University in Australia as well. And he tends to find time, apart from so many hats he's wearing, he still finds time for all these sessions. So it's great to, such a motivation to have him around. So Dr. Kishore, I'll start the session with the first question. So just if you can help us define what is CDSS and how it can be used in point of care clinical settings at the bedside.
At the outset, thank you very much for the kind introduction, Rohit. And it's always a pleasure to talk to you. And thanks to Voice of Healthcare for organizing this exchange of views. Yeah, CDSS is nothing but a clinical decision support system, a complicated word for a common word which everybody knows is AI, that is artificial intelligence in healthcare information technology. Basically, it provides clinicians, staff, and patients with knowledge and person-specific information, which is intelligently filtered and presented in appropriate times to enhance the healthcare and efficiency. That's what CDSS is. And how it can be used in the bedside? It can be used in two different ways. Basically, it can increase the quality of care to enhance the health outcomes. It can avoid errors and adverse events. It improves the efficiency, cost benefit, and provider and patient satisfaction.
Yeah.
Over to you, Rohit.
Yeah, absolutely. So we need to avoid medical errors, and it's one of the steps towards avoiding all those medical errors. Surprisingly, do happen no matter what we do. Okay, so CDSS definition is clear now. Next question would be, how will you ensure that CDSS-based systems deliver what they promise and yet are cost-effective and sustainable? Right? So always the cost is important for the sustainability part. So how do you ensure that it is cost-effective and sustainable?
That's a very, very important question and a good question, Rohit, because I'm sure the cost is a big factor, especially for us in a country like India, where it is cost sensitive. But one has to understand that CDSS is not a new thing. It has been slowly percolating into the system one way or the other. I'm sure all of you are aware that artificial intelligence has made big inroads into many areas like air travel, ticket booking, and various things. So even in medicine, it's no exception. There are two main types of CDSS. One is a knowledge-based and the other one is non-knowledge-based. The non-knowledge-based CDSS has already infiltrated into the medical system. It's rapidly growing use of artificial intelligence in medicine, and definitely it produces recommendations and problems with the data availability and various things. Many people, including the doctors, may not be aware of the use of non-knowledgeable based CDSS. What we are talking is the knowledge-based CDSS, which has rules and associations of compiled data. Most often, it takes the form of if-then rules. If this were to be a system for determining the drug interactions, for example, then a rule might be if the drug X is taken, then Y is taken, then alert the user. Many people may not be aware, especially specialized areas like radiology has already built inroads in a big way in the use of CDSS or AI to detect things like stroke in a CT scan of a patient, because many areas may not have a radiologist available at odd hours. Many areas may not have radiologists available during the working hours also. So these images are interpreted in an emergency by the machine, and this has been available for almost 5 to 6 years, which may not be known to many doctors. And the rapid report which is available helps the patient care in a big way. So the cost, why I'm saying that is the cost of treatment actually with the CDSS is actually coming down. So imagine if you have to wake up a radiologist to say, is there a stroke in the CT scan? The charge of a radiologist is going to be added to the CT scan, whereas if an AI can interpret, it will be much cheaper to get a CT scan in that sense. So in other words, the efficiency increases. So the CDSS actually helps to reduce the cost in healthcare. So it definitely is something we need to look forward to. Back to you, Rohit.
Yeah, absolutely. So it has a huge future, and the more we use it, the cost will gradually keep on going down. Yeah, absolutely. So how, Dr. Kishore, how I understand is the non-knowledge-based CDSS is like Alexa and Siri, right? Is it? It learns from your previous behavior and it tells you based on the previous behavior as to what to do. As the knowledge-based one is, it has got ingrained knowledge into it, and it integrates the patient's information and then helps us with the diagnosis. Is that correct? Is that the easier way to kind of for me to understand?
Yes, that's more or less that way. I mean, I wouldn't say it's similar to Alexa, because Alexa, to a certain extent, uses the knowledge base. That means okay. Alexa, for example, says, "So you like Muhammad Rafi," so it learns from your inputs.
From my
to a certain extent, that is knowledge based. When I say non-knowledge based, is like, okay, you are an adult male, 48 years. You are at high risk of hypertension, diabetes. That's a well-known fact. It doesn't require any knowledge, and it puts you in a different category. Yeah. Or if you say, look, you you are coming from South India, and South India, in fact, clearly the delineates that you are a high risk of diabetes. So that's well-established facts, and there is no major thing. So that goes into the non-knowledge based. Okay. Knowledge based is where, okay, there is an artifact here. Is it an artifact, or is it really a stroke feature? There is a lymph node here. Is it really tuberculosis, or is it a lymphoma? That sort of a thing has to be knowledge based. And that's where there is a lot of skeptics who are talking about CDSS or AI replacing the radiologists completely in the near future, and they feel that both the dermatologists and radiologists will be extinct in 10 years' time because AI or a CDSS is going to take over their fields.
Right. Okay.
Back to you, Rohit.
Yeah. Okay. Perfect. So moving on. So next question is, what has been the experience so far with CDSS in other medical specialties, and how, as you have already mentioned somewhat, and how it can be put to use in neonatal pediatric patient care?
Yeah, this is a very, very good question, Rohit, again. And as I mentioned briefly about radiology, similarly, the CDSS or AI has made a lot of inroads in oncology too. Now, many of the people or the doctors may not be aware. In oncology, for example, if a patient goes with the diagnosis of leukemia, taking the patient demographics, it gives the appropriate protocol which is best suited for that patient to give the cure. In other words, there are, say for example, the child is diagnosed with acute lymphoblastic leukemia. There are so many protocols, UK protocol, US protocol, this protocol, that protocol, which one to suit. And sometimes what happens is, as doctors, we take preference to with whatever experience we have. With the AI, definitely it picks up the best protocol, which gives the best treatment. And to a certain extent, this sort of protocol-driven care and the oncology drugs to be chosen, for example, for specific cancers, have been so much driven by the CDSS in the last decade. Yeah. It has improved the care in a big way. So both radiology and oncology has benefited from CDSS in a big way. Dermatology, for example, is going leaps and bounds, and with the teleconsultation and the quality of the images, as I said, there is a talk of dermatologists becoming extinct because ultimately, dermatology is either steroids or no steroids for the creams to be used. Yeah.
And pictures of skin.
CDSS can pick up which needs steroids and which doesn't need steroids, they're out of the window. Yeah. Now, your second question, how it can be put to use in neonatal pediatric. Many people in the audience may not realize that pediatrics is a very, very complicated subject. People like Rohit makes it look very simple, but the dose of the drugs used in children and babies depends on the weight of the baby. So, as you can imagine, we see babies anywhere from 500 grams to up to 80 kilograms as a teenager. So the dose cannot be the same for all the groups. So AI actually helps you to calculate the dose and avoid the errors, because sometimes when you're sleepy, you can easily write milligrams instead of micrograms or micrograms instead of nanograms. And human error has been accounting for almost $30 billion of medical errors in the US. There is no such statistics available in other countries. So CDSS can help to reduce such medical errors in a big way in neonatal and pediatrics. Back to you, Rohit.
Yeah, absolutely. I mean, look-alike, sound-alike drugs. There are so many things which are there in medical errors, and CDSS can definitely help, alleviate all those things. Yeah, and also I was going through the literature in adult world, and there are some systematic reviews available as to that CDSS has played role, just like you mentioned about radiology and dermatology and oncology. So even in like situations such as blood glucose monitoring, So they mentioned blood glucose monitoring, acute kidney injury, and pressure sores. CDSS has been shown to be way better than existing EMRs or clinical decision making. So AI is really, there are like multiple studies and there are systematic reviews also. So
absolutely.
Yeah. So perfect. So yeah, we need it in our pediatric setups as well sooner than later. Okay, moving on to the next question. I think again, partially you've addressed this question as well. How important is medication dosing in neonatal pediatric patients, and how CDSS can help to reduce medication rate? I think you've answered this already. If you want to just say a few more things on this.
Yeah, I mean, the drugs in pediatrics and neonatal are totally different compared to what we use in neonates and pediatrics is, significantly different. A sick neonate can need infusion of drugs which are calculated per kilogram per minute, whereas the older children we calculate per kilogram per day. So calculating per minute per day can be quite a taxing challenge, especially for a doctor who has been sleepless in the night. So AI definitely, or CDSS, can reduce those sort of medicated related error, and definitely it's a saving, because a milligram to versus nanogram to per kilogram per minute to per kilogram per hour can make a huge difference. Either can kill the child or can save the child in a big way. So it is very, very important, and that's why it has started making a huge difference in pediatrics and neonatology.
Yeah, I mean, anytime we do audit on medical drug-related errors, there's always something. Like, it's surprising how much we take care of it. Still, there are some errors. Like annual audits where we have done for last 5 years, every time there is something or the other. So I hope CDSS should be able, like, right from writing the drug by the doctor to how to prepare it, pharmacy using it, to nurses administering it. There can be, that kind of checks and balances are there, but still errors do happen. We know that. So artificial intelligence can definitely help out with that. Okay, so next question to Dr. Kishore is, this is an important one. Will integration of CDSS with existing EMR lead to better implementation and increase its utility in clinical decision making?
Yeah, that's a fantastic question, and it's a practical question. The issue is the answer to your question, the short answer to your question is, I should say, will it increase the utility in clinical decision making? It's absolutely yes. But India being the software capital of the world, we don't have too many EMRs which can be integrated with the CDSS. So it is essential that we work in conjunction with the relevant IT people to integrate EMR and the CDSS in a big way, because without that, the documentation becomes difficult. And if there is no documentation of what you do, the lawyers will have the last say in most of the fields. So it is important that whatever we do is documented in the EMR, and hence integration with the CDSS and the EMR is crucial. Plus, when we look at the progress reports, and as you rightly mentioned a few minutes ago, when we do the audits, if there is no documentation in the EMR, then where do you look at? So absolutely, the integration with the CDSS and the EMR is very important and very practical, and it is essential even for research purposes and to improve the quality of the care.
Yeah, no, absolutely. I mean, for it to be sustainable and, for nurses to continue to do that, otherwise they'll have to put two separate data sets into, like, EMR also they are entering, and then CDS is also. So yeah, I mean, it's a hassle for nursing people. It's a deterrent to, use it properly. So yeah, unless we integrate it, it will be a challenge to kind of convince people to use it regularly. So yeah, let's hope. I mean, we can have our own indigenous CDSS here at some point, as you said, India being the software capital of the world. So yeah, hopefully that will come sooner than later.
Great.
All right. So sir, next question is, please elaborate a real life case study where CDSS has helped the care of the team. I think, yeah, if you have any case scenario in your head, maybe, or I'll move.
Yeah, we didn't have in our hospital, but certainly we were talking in one of the conferences recently where one of my colleague was sharing information about how the CDSS has saved, because one of the doctors, junior doctor who had worked in different specialties, was doing a locum. And locum means a temporary doctor. This is where the majority of the errors, because some pediatric person may come to do neonatology and they may not be used. And one of these people had written milligrams of morphine instead of micrograms of morphine for a 500-gram baby. Fortunately, the CDSS and the alert nurse both picked up and saved the baby. Otherwise, it could have been disastrous.
Yeah.
So far, we have not had any major disasters to say that CDSS will help the care, but definitely it has increased the accuracy and definitely it has improved the quality of care.
Yeah, absolutely. I mean, it goes hand in hand with our clinical judgment and nursing, as you mentioned, nurses. So it assists us. It doesn't replace our clinical acumen and everything, but it does help, assisting in making the right choices. So yeah, okay. And as we will have it more and more into our system, we'll have more examples also gradually. Okay, I think we have one more question left, and then maybe we can have a chat, discuss further. So Cloudnine is the first to adopt this technology in pediatric neonatal population. How can the other hospitals learn from your experience and adopt this technology?
Rohit, this is a very, very good question. I wish I can give you concrete answer. What I can say is we have been technology oriented from the day one. See, when we started Cloudnine 15 years ago, the phototherapy equipment, for example, was tube light based. Then the LED came around 2008, 2009, which meant replacing all the phototherapy equipments with the LED. And for a small hospital, which was a startup at that time, that was a significant cost. Yeah. But we knew that LED will reduce the average length of stay. So we didn't hesitate to replace the phototherapy equipments and change the equipment. So technology has always been in our blood, if you want to call it. So we have been adapting the technology from day one, whatever is available. Many of the CDSS, what we are trying to do is in the pilot project. For example, we have been associated with Israeli software where it looks at a maternity and newborn care, and the AI is supposed to reduce the number of C-sections because it can give alert that this lady can deliver normally, this lady has high risk or low risk or whatever. And this has been proven in centers like Johns Hopkins and research. We are one of the first hospitals to use this sort of technology, and we are trialing that era. Then CDSS we have been using, as we were discussing just before we started, in tele-NICUs across various centers, and the ICA from Philips is definitely helping us in a big way. So in various options, we are slowly integrating our software into various fields, and definitely it's a beginning, or I should say, we are at the verge of changing the healthcare for the better for a consumer in a big way. I shouldn't say consumer because it should be said that it will be big help for even the administration, because the cost of healthcare will significantly reduce in a very way. Safetiness will increase, and definitely the quality of care will increase. So everything adds up for the better for everybody. So it is a boon, and hopefully we should definitely look forward to embracing this technology. But like everything else, there must be errors which needs to be titrated. So that's why in the initial phases, it needs to be watched. But having said that, for example, in radiology, for example, when they analyze the CDSS for identifying CT scans for stroke, the accuracy was 95%, whereas the human accuracy was about 89%. So accuracy with the CDSS was much higher than the human. So definitely, depending on the field, we need to compare with the human intelligence and keep getting better and better. It is always a combination of efforts of the whole team, starting from algorithms, creator, IT industry, technology, then HMS, and interpretation by the doctors and usage. So there may be a good CDSS software, but if the doctors are not utilized or trained in using that, then it will be of no use. So we need to come forward to embrace the technology for the right purpose and make a difference in the healthcare in a big way. I think I've spoken quite a lot.
No,
Back to
that's
you.
perfect. Yeah, I mean, somebody has to take the stand and be the pioneer, and others will follow for sure. Yeah, so Dr. Kishore is just being modest. I'll just elaborate a little bit more on the ICA thing. So Dr. Kishore has envisioned, having a quality NICU care in level tier 2, tier 3 cities, and then they being provided the best of the care possible, similar or at par with other bigger cities, and being manned by from the central command center. So this is the project which Dr. Kishore has envisioned and is being carried out. And maybe in future, going along as we are discussing CDSS, maybe it can be incorporated into that ICA software, because as we discussed, EMRs can be incorporated, and that's a thing to be discussed about in future. So I think I've run out of questions at this point. If anything else, Dr. Kishore, you want to take it from here? I guess it's so to conclude, I think it's artificial intelligence is the way to go. It's a future. Somehow or the other, it has to come into the healthcare. It is already existing, just that in the pediatric and neonatal setups, it's taking time, and I think it's already started now and it needs to be taken forward. It's a prototype thing, and it will only improve as we go along. We can have questions coming up for us. So Dr. Kishore, there's one question. Is it possible to evaluate the quality and impact of CDSS?
Absolutely, absolutely. So that's why we always say a pilot project is essential. For example, recently we were trying one of the CDSS wherein a patient wears a band soon after the surgery. And normally in a normal circumstance, what happens is the nurse goes and checks the blood pressure, pulse, and saturation every 15 minutes post-surgery, depending on whether it's a high-risk or a low-risk surgery. With this band, continuous recording of the pulse rate, heart rate, respiration, saturation, and temperature, all are recorded. And with the AI and CDSS built in that, any dip in any of those or any variations, the alert goes to the mobile of the anesthetist or the critical care specialist straight away. So it doesn't wait for the nurse to come and check it. And that way, the response time is reduced. So there are lots of variables which can be put on the patient and improves efficiency. This is just one example of how the post-operative care can be improved in patients. So definitely the question is, can we evaluate the quality? And the answer is yes. It all depends on what parameters you set up and what parameters you want that to report. Because ultimately, it's a work done by a computer with the software. So if you set up, for example, saturation less than 90, then it will alarm at less than 90. If you set it up at less than 89, it will alarm at 89. Now the question is 89, 90 when it records, is it accurate? It depends on the temperature of the patient and it depends on the perfusion. So all those things have to be taken into account. That's why all parameters have to be taken into consideration rather than just jumping and say 90 saturation or 89 saturation. So it ultimately gives you a report, whatever you need. How to interpret and how to react definitely needs a human intervention at this stage.
Yeah, no, absolutely. I mean, the data is there right in front of you, right? You can always evaluate pre and post CDSS, right? So you have the data which is being collected while you are using CDSS, and you can always compare it what it was used to be before CDSS was implemented. So yeah, evaluation is probably not a problem. It's just a matter of time. You have to use it for a specific period of time, and then you can evaluate. Perfect. So there's one more question. I think we have answered this a few times. So why do we need CDSS as part of patient care? So
well, that's a good question. I think, as you rightly said, Rohit, we have answered this question. For those late joiners who had not heard, CDSS improves the quality of the care, and definitely it reduces the medical errors, and definitely it it improves the efficiency, and it also improves the patient and provider satisfaction, and it gives you enhanced health outcomes. So the aim of using CDSS is to improve the efficiency of the healthcare and reducing the errors and adverse events, and of course the cost benefit ratio, which we talked about it earlier.
Yeah, so many advantages. Perfect. Okay, any further questions? This is what I have. This one. Okay, Khushbu, do you want to take over?
It has been an absolute pleasure to talk to you, Rohit.
Same here, sir. Yeah, absolutely.
Thank you to the team of Voice of Healthcare and Khushbu for doing the background work and organizing this webinar. And if there are no further questions, sincerely appreciate the.
Thank you so much. Thank you, Dr. Kishore. Thank you, Dr. Rohit. To all the attendees, we have concluded the session. Thank you so much for your participation.
Thank you. Thanks a lot. Yeah, bye.